Friends, when we look at adult males who actually have grown up into a situation where they look at functionality of the male organs to be as good as their peers, we find that there is so much of need in the society which is actually missing. Penile surgeries or penile rehabilitation or penile augmentation or penile therapies, that means treatment of penile organ, sadly could be missing in the society, partly because, again, we don't speak up. We live in agony and shame. We sometimes go to urologists, and many urology colleagues may not be deep into this subject. As a subject, urology deals with genitourinary system, where on one side we deal with genitals, on the other side we deal with the urinary system. So it's one specialty where you deal with organs which are inside the body, which are adrenals, kidney, ureter, bladder, prostate. And then you deal with organs which are external, which means you have the external urethral meatus and a part of the urethra which is external outside the body, housed within the male organ called the penis, which again subserves the function of erectile issues which men have, and they probably miss it out. So who is a needy in penile therapies is an important aspect to care and probably cure, because the aspect of cure of penile issues is again a big time question for a lot of people as to where to go to. Some colleagues who have got issues with penile problems go to sexologists, who are good medical therapists who looked into and talk to you, sometimes also examine you. But when you look at a urologist and then a uroenterologist and somebody who works deep into penile therapy and treatment, I think as a doctor on the opposite side of the table, when you are relating all these aspects of your penile worries on the organ size, on the organ deformities, on the organ caliber, on the organ capability in the bed, and obviously the kind of dysmorphobia which develops many a times because the organ does not look like somebody else's or something what you probably dream and envisage to. So penile therapy or treatment of penile disorders is another big challenge in the subject of urology. A part of that is handled by the andrologist, but that subsection has not developed very well in India, also in many parts of the world. And therefore, people who are needy on this aspect, who have actually matured into males and then need therapy, is a difficult question to answer. On one side, if I tell you what kind of patients I get to see at the Kokilaben Hospital, referred from all across the country and the world, are young adolescents who have grown up and whose penis has not grown to the size that they probably expect or they deserve. On the other side, that's largely because of hormones, and many of them are micropenis, or many of them are hidden penis or buried penis. On the other side, we have got this very young, obese, fat individuals whose penis is completely buried and deeply buried within the pre-pubic fat. Then we look at individuals whose penis has unfortunately undergone surgeries for the urinary system, where you have the hypospadias patients in childhood, one or umpteen surgeries, and then a more difficult group called the epispadias surgeries, where the penile and urethral disproportion, the entire aspects of initial surgeries to bring about continence and control, and thereafter to bring about the larger picture of translation from an adolescent to an adult, where the penile organ is capable enough to perform, are huge challenges. So that group of individuals or adolescents and who grow up in their urinary system and in their adult male system, where a sexual system is developing parallel, may not be matching their needs or not be matching to what we expect them to grow, is a huge burden. So when the baton handing happens over from a pediatric surgeon or a pediatrician to a urologist, many a times that's messed up. So at the center in urology at the Kokilaben Hospital, penile surgeries, which we deal with regularly, in this aspect of care is a very important aspect. Obviously, it is to match a huge amount of expectation with the expertise that we have, and that's hugely evidence-based. We move forward and look at adult males. Now, adult males, when they grow up and they find their organ not capable enough in their partnership, then they find that what is the missing thing? Many a times their missing thing could be completely scientific, and many times it's hugely anxiety related. Not able to perform in the bed with a partner is a huge anxiety issue, which is compounded by many other organic issues which can happen. I always keep telling all those people who smoke that as you smoke gradually, you smoke your life out of your penis, because their erectile capability gradually goes away. So some people say we can decrease smoking. I said, no, you not to quit. You got to quit a poison which is poisonous to the body in terms of umpteen carcinogens that causes cancers in all systems, including lungs and urinary system. On the other side, you need to quit smoking towards the long-term aspect of keeping yourself regenerated well, where smoking and the carcinogens and the changes which happen around in the epithelial lining of various tissues doesn't let you regenerate. The entire capability of a male organ to be able to relax and contract, and the blood flow inside is largely dependent on the kind of toxins that you probably take inside. So quitting smoking is important. I'm just using the larger jargon to make people understand that penile therapy is medical and largely surgical too. And now we don't operate people for dysmorphobia, we operate them for penile deformities, penile augmentation, penile therapy, where we use penile processes. And the kind of processes that we use now are the Indian processes. You have the process coming in from the Argentina and the American world, which are malleable. And they're helping a lot of people who are just incapable of penile penetration around. So the aspect of penile deformities or the Peyronie's disease, where there's a bend in the penis, the bend doesn't let you perform, or the bend is too much and progressive and has stayed at a point in time where you don't know whom to go to. And then you look at the kind of torque and the twist and the curvature, the size, all of them actually become quite a situation around. I speak to you today because over the last few days, there's been a spate of people coming in after various treatments done. Somebody saw a sexologist and got some medical treatment done. Somebody had an expectation that like year by year, my penis grew, year by year, my things would improve. And they went on for a therapy on medical side for a very long time. Whereas the deformity could not have treated medically. So there are medical aspects of care and there are surgical aspects of care in a penile therapy. And some penile therapies where the erection is just missing, usually we handhold the journey of improving their erections by talking to them, the empathy and understanding with the person, and probably with a couple if they come in around. But many of them are young men, males who undergone various therapies already. So all youngsters who have been epispadias and hypospadias therapies and their penis is straight, penis is capable enough in terms of being able to pass urine well, number one, give a direction to the stream, and probably is good enough to capably now perform as a male in the bed to their partners, I think they are good enough. For those epispadias and hypospadias patients whose penis is short, deformed, bent, crippled, I think it's important for us to look at these kind of patients around on our awareness drive and make them understand that you possibly are capable of getting better. Your penile deformities or your bend can be straightened up. You will look good. Sometimes the defect could be such that we need to do a surgery which is segmentally improved by looking at the first and the second aspect. Many times the urethra is just tethered completely like a skin tube out of childhood surgeries, and the organ grows and everything turns into a crippled, grotesque looking bent organ. And these organs are something which we need to look into. So at the center of urology at the Kokilaben Hospital, with all these issues of people who are coming with penile issues, I get to see people coming in from various aspects. While we create new organs or new penises for transgender males, on the side, we look at people who have got penile amputation, penile injuries, penile burns, and who probably need a completely new penis, to people who actually would need a penis to be capable enough where we put penile prosthesis, to be looking at some people who actually have just not come out of their adolescence by the lagging of the hormones, and therefore I write hormone therapy and close monitoring. And there are people who are just awesome, even at their 20, 25, with lagging behind milestones on the penile growth. So I think we don't groom everybody by one subject or one kind of a groom, but we look at right approach to the right individual in penile augmentation, in Peyronie's disease or bends and curves, in various hypospadias, epispadias, issues of childhood, which has not grown up into a mature male organ that is capable and straight. And then the aspect of penile augmentation for people who have got penile shafts, which are shorter, which are less girth. And those are very challenging areas. So challenging areas are something which over the last 2 decades gradually built up to levels of understanding. And with leaders in the world, we have been able to take this subject to the next level altogether. So to match the expectations of the needy, it is important for many people to be knowing that you need not get stuck with one kind of a therapy and being there around. So I would label that while we look at andrology as a very important aspect and look at all aspects of male sexual organ healthcare, including fertility on one side, other side, the male organ capability of being able to perform in the prime years of your life is equally important. And sadly, this is just an untouched subject completely. We, as caregivers, probably don't speak up loud. And people who suffer on the other side of the table, who are a huge subject of people around, continue to suffer because don't know whom to go to, got some therapy, got some medications, got some vitamins, and continue to still live the life of agony. I think we need to probably be a balance. We also need to be partners in terms of understanding nothing like a hyper real expectations, but what expectations can be matched today. So I think these are all happening. Let's go by a real-time experience of helping people out in this aspect. So penile deformities, penile surgeries, penile augmentations, penile prostheses, Peyronie's disease is a completely large subject of penile healthcare in the domain of andrologists, which many of them perhaps may not be doing it. You're welcome at the Kokilaben Hospital to see us and help you out in terms of various kind of penile deformities to be corrected completely. Thank you so much.